Hi, everybody. It's Jessica DeMassa with What's the Future Health. We are talking to the who's who of healthcare innovation and health technology. And today, do we have a crowded room with some of health tech's who's who have just recently combined into a digital health super company. Please meet the executive leadership team of UpHealth. So hi, everybody. We'll introduce you one by one here. Please meet Dr. Chiranjeev Kathuria. He's the chairman and founder. Give us a little wave so we know who you are. Dr. Algat Maitan. He is the co-CEO and president and the current CEO of Cloudbreak Health, who will become the chief operating officer of UpHealth when the deal closes, but not a moment sooner, Jamie Edwards. Welcome, everybody. It's so good to have you here.
Great
welcome. To be here, Jess.
Well, I mean, this is so fun for me because, I think the market really took a huge interest in UpHealth, and not only because of this whole idea of digital health super company, but just the fact that it was 6 companies coming together to go public via a SPAC. And so I want to dive in right there. I want to hear about the 6 companies that have been brought together just really quickly. And I'd love to get an update on where you guys are at with the SPAC IPO or the SPAC public offering process and when the stock is going to start trading. So Chiranjeev, let's start with you. If you could just give us kind of that overview of the 6 companies that are part of UpHealth and let us know where you're at today.
Sure. I think, Jess, if I were to describe UpHealth in a couple of sentences, I think we'll be the first truly global, profitable telehealth public company. And we are operating in leaders in the 4 fastest growing areas of digital healthcare, which is global telehealth, integrated care management, digital pharmacy, and behavioral health. And as you mentioned, we'll be filing the S4 this coming week, so it's moving very quickly. And we just closed $285 million of a convertible and a PIPE last week. So, we're ready to go. We have enough growth capital to really transform us and become leaders in the space.
That's exciting news on that 285. That was oversubscribed, am I right?
It was incredible. And I think we did it in almost 72 hours. So there was incredible demand for digital healthcare.
What do you guys think that means as far as the market and being ready for a company like this that has pulled together these 4 fast growing areas? Jamie, you want to take a crack at that?
Yeah, look, I mean, looking at the confidence that investors had in our story was truly gratifying. And we know that the story started off being a little complex, and our goal is to simplify it for the market. And when you take a look back at what Chiranjeev's original vision was, which was to purposely bring together companies who could create what is a digital health super company that supported really local healthcare and local healthcare digital infrastructure, and not just here in the United States, but globally. That is for what us at Cloudbreak really wanted us to engage in a big way in making this happen. We saw the opportunities to really work with the other businesses, and what got us really excited was that all of these businesses are purely complementary to each other. So there's minimal overlapping customers and things of that nature. The story here is really about all the revenue growth that can come from all of these companies working together and becoming a one-stop shop for digital infrastructure for global healthcare.
Al, I want to pick on you for a second because I understand you're former COO of IU Health, which is a big health system. Why hasn't anybody done this before? Especially like a health system. I mean, this is like, I don't want to say it's a no-brainer, but it's like, why hasn't anybody pulled this together?
Well, perhaps, seeing the problems with healthcare delivery, which was very evident, as you said, I've been in the C-suite of a $6 billion integrated health system. It's easy to see the problems, much harder to solve for them. And quite honestly, it's required a group of innovators, which is what UpHealth really represents, the founders who have innovated for over 10 years. We have a group of founders who over 10 years ago saw what could you do in a transformation of healthcare if you had the Internet of Things, if you had advanced computing, if you had broadband, and they've all solved elements of that. So now we have this collection of best-in-class technologies and tech-enabled services that are much farther up the value chain in solving the problems for the major end users, like a health system, a health plan, or even a government ministry. So I would say probably my short answer, Jess, is it's taken a great deal of innovation And that just, isn't maybe a core competency of some of this established health plans, government services, and health systems. But we really believe this coming together of these innovations help power these end users to a true digital transformation.
Do you think the funding vehicle for this, like having the ability to form this and go take it public as a SPAC, did that contribute to making this a little bit easier?
Let me answer that, Jess. I think there's a couple of things. When we saw Teladocs go public, and then Livongo go public, and then Amwell, and then recently GoodRx, whenever you have large public market players, you tend to see consolidation in the industry. And then when Teladocs brought Livongo for almost $18.5 billion, we needed to access the public markets very quickly and have access to growth capital. So the SPAC was the fastest way for us to grow, to get public, access to public markets with the cash in the trust of $170 million plus the $285 million. We'll have $455 million of growth capital. So it's like what Alexander the Great, when they asked him how he conquered the world, even though India stopped him, he replied by not delaying. So this was our fastest way to go public and access growth capital.
Oh my God, what are you going to do with all that growth capital? Can we talk for a minute about this integration? So I want to hear about, before we get to the future, I'd like to hear about state of play currently. Where are you at now in terms of bringing those 6 companies together? So are you guys co-selling at this point? Are all 6 companies firing on the same cylinder? Are you building things out? Somebody give me an update of where we're at today with the integration.
There's a couple of layers to that question, Jess. First is our projections through 2022, we have a revenue CAGR of 74%. And that is based on 0 synergies among the companies. So that's because we're hitting these companies just at the inflection point. They have an established customer base, the largest US health plan, public health plan, 1,800 care venues where Cloudbreak is, 1,000 physicians, and 9 international countries that were already contracted. So we have that tremendous growth on revenue, of which in 2021, nearly 70% is already contracted that we just need to execute on. So on the integration, I just wanted to point out that on through 2022, our revenues aren't dependent on this integration. That's what gives us such a tremendous foundation. Now, speaking of the integration, as Jamie mentioned, these technologies and services are highly complementary, and we are engaging in conversations now with major end users, a value-based PBM that's already with our integrated care management. How do we incorporate our focused pharmacy solutions? A major public health plan that's already engaged already with UpHealth. How do we incorporate behavioral health, focused medication, and interpretive or telehealth services? So those conversations have already started, and we're very, very excited about the potential of those. We also have several other national ministries in India, West Africa, and Southeast Asia that are in near stage or near end stage negotiations. So that number of 9 countries will quickly expand. And they're looking for both access to care, which our Glocal solution remarkably provides, but other solutions that would help them better manage the total care value equation for their countries. So wonderful opportunities in the blending of these technologies that we have, and those conversations have started. And but it's just important to underscore that our projections actually have no assumptions of any of that integration revenue. So great upside.
That's amazing upside for UpHealth, right? But I'm curious, do you feel any pressure to integrate? I mean, particularly as you're looking at, and you guys had mentioned Teladoc and Livongo as they've been integrating, and also with the acquisition that they made earlier last year of InTouch, which is a big hospital telehealth player. I mean, are you guys feeling any pressure to integrate sooner rather than later?
Yeah. Oh, well, we're definitely, I didn't mean to say we weren't doing it. I'm just wanted to underscore that our projections weren't dependent on an immediate integration, but the opportunities are there. So I wouldn't call it pressure at all. We have a broad customer base and they're asking for this. So now it's our opportunity to engage them to better understand their needs and then deliver this more unified platform of services. So pressure, not at all. I think the expectations are that's what we set out when we unified, is to do this very thing. So it's not pressure to do what you want to do. And then the demand from our customers is very strong. So we're excited about that.
And there's multiple levels of integration, Jess, right? So, you talk about, product integration and how's that going to work. And the great thing about how all of the products have been built at UpHealth is they're all on the latest level of technology stack. So API-driven microservices, all those different types of things that make this interoperability between all of the product suites very natural. So that's obviously one level that can really help drive a lot of revenue. And then the other is on the cost side. And the great thing is all of these companies, it's not like any one of the companies has a huge HR department, huge accounting departments, et cetera. We are taking what our company is at an inflection point of growth, and then we're going to build what is best in class corporate services over the course of the next half year to really drive efficiencies across the platform. The story really isn't a cost synergy story on its core. It's really a revenue story, and being able to take advantage of all of these different platforms for what is now a much more diverse client base. And an example of that is Cloudbreak really has the local U.S. healthcare system market tied up, right? So we have a lot of presence there that could be meaningful for the rest of the companies. Bracis has that with payers and education and government. So you take a look at that, and then MedQuest, which is the pharmacy company, has that in the doctor office market. And so there's applicability for each of the company's services in markets where these other companies already have a pretty penetrated presence.
Have you been cross-selling yourselves over there, Jamie? How's that going? What's the reception been like among the client base?
Yeah, it's been, some of the companies have been doing it already. Cloudbreak was later to the party than some of the other companies who have been collaborating for a longer period of time. But we've already had discussions with our clients who are very excited about the potential for us to bring behavioral health services with our mental health division, who might want to use the population health tools that integrated care management offers via Thrasis. So yeah, those conversations are happening. And, look, a lot of this came about, and Al said it before, because we were listening to our clients and what they wanted. And now we have the ability to deliver that for them and not just do it on a national scale, but globally.
Who do you guys see yourselves competing with in this space then? Is there anybody that's really, of course, you're differentiated, we know, but who do you see as the next closest competitor?
Yes, so we are in our technologies and tech-enabled services are in 4 distinct markets: integrated care management, behavioral health, e-pharmacy, and global telehealth or digital health encounter. And there are distinct competitors in each of those spaces. We're really distinctive in that we cover all 4 and that we can provide the major end users, health systems, health plans, and government ministries, this unified solution. So while we'll be competing across the board in those 4 distinct areas, it's very difficult to find someone who is competing in a unified manner across these 4 segments the way we are.
You don't see Teladoc as a competitor or Optum, what they've been building over there. They've got a little bit of everything, which makes them very dangerous.
Yeah.
But let me just give you one statistic and then have Jamie, jump in and out. We won the largest telemedicine contract in India and the state of Madhya Pradesh. Just that one contract, our telehealth visits will exceed the largest publicly traded digital health care company in the U.S., just to give you some perspective. But go ahead, Jamie.
Yeah, I was just going to say, there's a massive amount of respect on this team for what Teladoc and Amwell and GoodRx and all those companies have accomplished. It's truly amazing. And we seem to be at this wonderful inflection point in time where one company doing work helps expand the pie for everybody. So the digital health market is just growing rapidly. I think there's going to be space for everyone. I think from a differentiation standpoint, Jess, If I take a look at Teladoc and American Wealth today, they have a very large medical group component.
Mm-hmm.
Right? So they are tech-enabled medical groups, and they're adding, slew of new services and started to take over other pieces of the continuum of care. We saw that with the Livongo acquisition and the InTouch acquisition over at Teladoc. So clearly very savvy. They have best-in-class services. So absolutely, I think it would be naive to think that at some point we're not going to be crossing paths with those businesses. At this point in time, we feel like our strategy is really differentiated because we are in the business of supporting local healthcare. We think local healthcare wins out at the end of the day. If I'm a patient, I would much rather know that I'm going to be seen by a doctor who can then escalate my care at that local health system to that in-person visit. If we're going to take a look at the acuity funnel,
Yep.
We want to know that, I'm really concerned about your chest pain, Mr. So-and-so. We'd like to fast track you to the back of the ER at XYZ hospital. That's what we are looking to provide, is across that care continuum, integrated digital health services. So we feel like that's a little bit of a differentiator. We're not going to be in the business of competing with our customer base, having our customers worry about suffering patient leakage from us or anything like that. It's really about how to support local healthcare with digital health tools.
Yeah, there's a tremendous, infrastructure already in place on providers and health plans. We are a B2B focus, so we'll be working with them, not as a parallel universe to them, if you will. So that's why it's hard to think of them covering the gamut we are. The other thing I want to point out is we believe we're advancing the discussion of digital health to the digital health encounter, and internationally, for example, that's where we don't see a competitor in that space. We really feel we have a novel solution.
All right, I'll back up a little. How are you defining digital health encounter? Because I think that is a key point that I think our audience should understand. So how are you defining that?
We kind of view digital transformation of healthcare, which is long overdue, right? It's the digital transformation of many other sectors of our economy is well underway. But I'm old enough, unfortunately, to say I've had the arrows in my back about the first electronic medical record in a hospital setting, 25 years ago. So first wave is going off of paper, and it's hard to imagine that wasn't that long ago, where you had a paper chart and you had paper submission of a health claim. So the first wave is automating the electronic medical record and the health claim, and that created data repositories. Wonderful advancements, positive. Then you have this more recent wave where you've added video and audio to the health encounter, and it's had some impact on access, perhaps quality, yet to be determined if it's had an impact on cost. And then you have now this wave of this Internet of Things, devices that can connect and maybe flesh that encounter out further. UpHealth is in this third wave where the digital health encounter is twofold. One, and Glocal is a perfect example of it, where you have a complete primary care encounter, physical workup, laboratory, and pharmacy dispensing with a physician diagnosis in 30 minutes in a fraction of the cost by combining engineering all of those things. It's a full digital health encounter, not simply a teleconsult. It's a remarkable solution. And then we now can augment that and put it into the Western world where we have healthcare deserts in the rural communities and in urban settings. You augment that with a focused pharmacy experience, and then you tie it all together with our Centranet solution, which is our integrated care management solution that provides connectivity and intelligence for not just clinical care teams, but for community teams, so they can finally work together as one. We believe that's a true digital transformation of healthcare, and that's what we believe we can offer to the major end users.
Where do you see the greatest opportunity for digital health encounters? And I'd like to ask that in two ways, I guess. First, I'd like to ask that, from a global perspective. You guys are already, I read, operating in 10 different countries across the 6 companies. I'm sure this will only grow. Chiranjeev, you mentioned that large contract that you guys have landed in India. So, where do you see the greatest opportunity here for growth, around the world as far as building out this digital health encounter? And I think to myself too, there's got to be something to be said for the fact, it's like if you equate it to like mobile technology, you know how like some of these countries didn't have to go through the paces of building this piece by piece, and then they can just jump in at a different point on the tech curve. So what are you guys looking at? Where do you have your sights set?
So if you look at it, I'm a physician, so we always say first do no harm and then do some good. So I think we're going to be able to help a lot of people. I started my career in the mobile industry, and exactly as you said, Jess, India and Africa leapfrog technology by providing landlines. I think we're going to see 2/3 of the world's population is in the emerging markets. So other competitors are like JD Health, WeDoctors, which are going public at multi-billion-dollar valuations. So I think we're going to see some of the greatest growths in India, Africa, the emerging markets. All the largest mobile carriers are in those markets. That's where they've seen their biggest growth. And not only what Glocal has been able to do, they've been able to provide high quality, lower cost healthcare in India, which is we could pick that up and put it into the rural communities in the US. So just to end, I think, we're going to be able to democratize, healthcare and provide healthcare, to everyone, high quality and affordable care. But I think that's the one unique position we have. We're going to have growth in the emerging markets, which is, almost 3 or 4 billion people. Jamie or Al, if you guys want to add.
Absolutely. And, the digital health encounter, I don't want to be misunderstood that I'm talking about one moment. Because of digital power, this encounter can be continuous, can be repetitive, and can be over one patient or a mass population of patients. And that's the power of digital technology, right? It can transform what we can consider to be an encounter. And that is right where we are at. Jamie?
And one of the things that I would just kind of add, Jess, right, is one of the themes that you will see throughout UpHealth is this theme of resolving healthcare disparities and promoting health equity. And when we take a look at what that means to the mission around the globe, here in the United States, from a Cloudbreak perspective, as part of UpHealth, it meant bringing language to the table. And because communication is the number one diagnostic tool that a doctor has, leveling the playing field for LEP and deaf patients. Well, now as you take that around the globe and talk about what UpHealth is really doing from a breaking barriers standpoint and breaking down silos, because that's a main part of the mission and model, is now we can help U.S. health systems support the health systems in other countries with the digital health technology. We can have countries who are abroad supporting the United States with potential more cost-effective resources when it comes to the lower acuity types of use cases that are out there. So it's all about breaking down silos or breaking down boundaries, not just between hospitals, not just within a hospital itself, but now between nations and cultures.
That's really interesting. And it sounds like it's not just, patients you're going after there, it's providers as well, which is really interesting. So very, very cool. All right. Last thoughts from you guys. I just, curious about the state of play here in the States. Let's talk about that real quick for you, because I think, obviously where we're at right now in the middle of this pandemic, vaccines are rolling out, albeit slowly, but, there has been a landmark shift in the way that digital health, telehealth, has been incorporated into the U.S. health system. What are you guys looking at moving forward as you look to build your business? I already heard you say multiple times rural. So, obviously you've got your sights set there, but what else do you have your eye on in terms of the way the market has shifted in the U.S. as a result of the pandemic and this, mass adoption of virtual care as ubiquitous, I guess, as something that's more commonplace than it ever has been before?
We are going to continue to follow our end users, our customers and partners. They're all on different stages of this digital health journey, whether it's a public U.S. health plan, whether it's a health system, a private medical group. And so we're going to follow them because that's our business to business model, is to power their efforts to this digital transformation. There's a broad and rich landscape in which we can deploy ourselves, and we're going to make those decisions or prioritize based on our customers' needs. And it's exciting, the conversations. In the first half of this year, we will be announcing some terrific additional expansions where we'll have multiple solutions at one customer. And it will be, again, in those areas where really access I'll leave it at that, where I think one of the greatest elements we can provide is this access to more personalized, targeted care and coordination.
Al, I love the tease of good news. I love it. You're going to have to come back when this announces. All right, Jamie, what about you if you were to add to that?
Yeah, look, I mean, from my perspective, Jess, it really boils down to a few things. Like COVID is to digital health. We're going to play a little bit of the analogy game here.
Great,
As meaningful use was to the EMR, right? It was this catalyst that allowed patients and providers to both build a lot of muscle memory around digital health tools and start to realize the promise. Certain things in healthcare just make sense, and digital health is one of those things. Value-based care is one of those things. And UpHealth is sitting kind of at the crux of those two in a Venn diagram, right? We have the ability, using our digital health tools, to support the new value-based care models that we think are the future of healthcare. So for me, that's what it's all about and where things are going.
All right. Chiranjeev, give us we need to sum this up in a quote or something wise to leave us with. No pressure.
I'll give you 4 points and end it with a quote. I think one is, UpHealth is an integrated global platform in 4 massive digital health markets, a rare financial profile with exceptional visibility into future growth. I think the executive team, as you heard from Al and Jamie, has demonstrated operational, financial, and technical expertise. And I think the value of UpHealth, it has a very attractive valuation benchmark relative to our digital health peers. And to leave you with a quote, there's a lot to do in this changing healthcare industry. So it's like Robert Frost said, the woods are long, lovely, and deep, but I have promises to keep and miles to go before I sleep. So thanks, Jess.
Perfect. Oh my God, nailed it. I think that's the first time ever Robert Frost has been quoted to me in an interview. That's fantastic. All right, the team from UpHealth, thank you so much for joining me here today. It was a pleasure to speak with you guys. Congratulations on the success of the SPAC so far, the fundraising that went along with it. We look forward to your S4 filing later this month, and then the subsequent listing on the public markets. Yay, we've learned something. So thank you guys so much for letting us pick your brains and hear about how the business is evolving. And you'll have to come back when all of this other news pops. Yeah. So don't forget about me back here. Al, Chiranjeev, Jamie, thank you so much again. I'm Jessica DaMassa with WTF Health. To find more interviews with the people who are leading the transformation of healthcare, please check out my YouTube channel at youtube.com/WTF Health. We'll talk to you guys soon. Take care.
Thanks, Jeff.